Let me ask you something. What would you do if your phone rang tomorrow morning and it was your mother? Her voice sounds off, weak, confused. She tells you she's burning up with fever, but somehow she's freezing at the same time. You tell her to lie down, to rest. You say you'll check on her later. 3 hours pass, and then you get that call. She's unconscious. She's in the emergency room. And the doctor looks at you and says, "It's sepsis. If she had come in earlier, she would have had a much better chance." That moment, that regret, it happens every single day. Right now, as you're watching this, someone is brushing off these symptoms. Right now, someone's organs are starting to shut down. Sepsis kills at least 350,000 Americans every year. That's more than breast cancer, prostate cancer, and AIDS combined. But here's the part nobody talks about. If sepsis is caught in the first few hours, survival rates jump dramatically. So today, I'm going to show you exactly what to look for. The 5 early warning signs that appear when treatment can still save a life. And the one sign that means you're running out of time. And before we begin, if you're watching because you care about keeping your family safe, hit subscribe right now, turn on notifications so you never miss information that could save someone you love. Drop a comment telling me where you're watching from. I read every single one. Let's begin. Most people think sepsis is just another word for infection. That's the first mistake. And trust me, it's a deadly one. Sepsis is not the infection itself. Sepsis is what happens when your body's response to an infection goes completely wrong. Think of your immune system like a home alarm system. When a burglar breaks in, the alarm goes off. That's normal. That's protection. But with sepsis, it's like the alarm malfunctions, and instead of calling for help, it starts detonating bombs in every room of your house. Your immune system stops targeting the infection and starts attacking you. Your blood pressure drops. Your blood vessels leak. Your organs don't get enough oxygen. And if it isn't stopped fast, your body goes into shock. Here's how serious this really is. According to the CDC, at least 1.7 million adults in the U.S. develop sepsis every year. At least 350,000 die. That means sepsis contributes to 1 in every 3 hospital deaths. 1 in 3. And here's what makes it terrifying. Sepsis moves fast. You can feel okay in the morning and be fighting for your life by dinner. You don't get weeks, you get hours. That's why this isn't just information. This is survival knowledge. Now listen closely. Sepsis can happen to anyone, but some people are in far more danger. If you're over 65, this is critical. According to the CDC, adults over 65 have a sepsis-related death rate of over 330 per 100,000. As we age, our immune system weakens. Infections spiral faster. If you have diabetes, your body already struggles to fight infections. A simple UTI, a small cut on your foot, that's all it takes. If you've had recent surgery, even minor surgery, bacteria can enter the bloodstream before you realize anything's wrong. If your immune system is weakened from chemotherapy, HIV, or steroids, your defenses are already down. And if you live with chronic kidney, liver, or lung disease, your organs are already under stress. Sepsis can push them past the point of no return. Men, listen carefully too. Men die from sepsis at higher rates than women. If any of this sounds like you, or someone you love, memorize what comes next. Let's talk about the 5 early symptoms of sepsis. These are the signs that appear before it's too late. Warning sign number 1. Extreme temperature changes. Most people expect a fever, and yes, many people spike over 101 degrees Fahrenheit. But here's what shocks families. Some people do the opposite. Their body temperature drops below 96.8 degrees. They're shaking. They can't warm up. They're freezing, even under blankets. If a fever won't respond to medicine or someone is shivering uncontrollably, pay attention. Warning sign number 2. Racing heart and fast breathing. Even while sitting still, the heart pounds over 90 beats per minute. Breathing jumps past 20 breaths per minute. It feels like you just sprinted upstairs, but you haven't moved. Why? Because your body is panicking. Your organs aren't getting enough oxygen, so your heart and lungs go into overdrive. Warning sign number 3. Sudden confusion. This one scares families the most. Someone who was completely fine an hour ago suddenly doesn't know where they are. They forget names. They say things that don't make sense. In older adults, this gets brushed off as dementia or stroke. But here's the truth. If confusion comes on within hours, not months, think sepsis. Sepsis starves the brain of blood and oxygen. Warning sign number 4. Severe pain or extreme discomfort. People with sepsis often say the same thing. I've never felt this bad in my life. Not just sick, not just tired. More like, something is very wrong with my body. It can be intense abdominal pain, chest pain, or a deep, overwhelming discomfort you can't explain. That's widespread inflammation, organ swelling, tissues breaking down. Your body is screaming. Warning sign number 5. Skin changes. Look closely. Red or purple spots that don't fade when you press them. Cold, clammy skin. Sweating while freezing. You might see blotchy, mottled patches, pale mixed with dark areas, especially on arms and legs. In severe cases, fingers or toes turn blue or black. That's tissue dying from lack of oxygen. If you see skin changes plus any other symptom I mentioned, don't wait. Not even a little. Now, here's the sign that means time is almost gone. A sudden drop in blood pressure. When systolic pressure falls below 100, your organs are being starved. Kidneys shut down. The liver fails. The brain suffocates. You feel dizzy, lightheaded, like you might pass out. And sometimes, you do. This is septic shock. And once sepsis reaches this stage, the death rate jumps to 30 to 40%. Let me be absolutely clear. If someone shows signs of sepsis and suddenly becomes dizzy, weak, or collapses, call 911 immediately. Don't drive. Don't wait. Don't hope it passes. Every single hour of delay increases the risk of death. Minutes matter. So what do? First, don't wait it out. Sepsis never gets better on its own. If there's infection plus these symptoms, call your doctor immediately. Say the word sepsis. If symptoms are severe, go straight to the emergency room. At the hospital, say it again. I'm worried about sepsis. That phrase triggers rapid response protocols, blood tests, oxygen checks, IV antibiotics, fluids, life-saving treatment, immediately. Speed saves lives. Sepsis is fast, it's ruthless, but it leaves clues, and now you know them. Extreme temperature changes, racing heart and breathing, sudden confusion, severe pain, skin changes, and the one sign you never ignore, dizziness or collapse from dropping blood pressure. According to national data At least 350,000 Americans die from sepsis every year. But thousands live because someone recognized the signs early. Your body warns you. Your loved ones warn you.